Hello everyone, this is Carrie Redmond, and my policy brief is on respite care for family caregivers, policy changes to address the needs of an aging population, and the overwhelming demands of caregiving. Prevailing trends indicate that 1 in 10 adults are caring for elderly family members. As disease and chronic illnesses progress and the population ages, the demands of caregiving will also increase. With this overwhelming strain in the caregiving role, respite care services can provide a solution. Although current Medicare coverage under Part A includes a small portion of respite care concealed by strict guidelines, the financial support for the effectiveness of the program overall is inadequate. Changing the current Medicare coverage parameters and expanding state and local funded programs could accommodate family caregivers. This in turn could reduce the costs associated with nursing home or alternative out-of-home placement, thus minimizing caregiver burnout, elder abuse, and promote aging in place. The stress associated with caregiving for an elderly person can be exhausting and overwhelming. These stressful lifestyles can result in serious health repercussions for the caregiver. More importantly, it can lead to abuse and neglect for those requiring care. Respite care services is an outlet of relief for those who experience the overwhelming demands of caregiving. Unfortunately, inadequate financial support and scarcity of trained caregivers for the effectiveness of adopting respite care are lacking, not to mention difficult to grasp. At the local level, respite care services are available through home health companies, community programs, and residential care facilities. First, if a caregiver is fortunate enough to contact an agency that recently received funds or is given the option of being placed on a waiting list for said care, they may be able to obtain a scholarship or a voucher through a caregiver support program. Secondly, the Area Agency on Aging Network receives grants at the state level to help support the caregiver respite care program, although a person applying must meet eligibility requirements. As you can see from the graph, the population is projected to boom in the next 30 plus years. This data reflects a desperate need to change or expand the current programs in place to help meet the needs of this increasing population. Wouldn't you agree? Under current Medicare coverage Part A, which is hospitalization, this includes hospice benefits for those recognized with a terminal illness. Respite care is recognized under this coverage. Medicare approves respite care coverage to relieve caregivers under certain conditions, such as it has to be a Medicare-approved facility, they must be diagnosed as terminally ill by a physician, patients are responsible for 5% of the cost per day of Medicare-approved cost, and it does not exceed 5 consecutive days of care or short-term care. Established in 2000 through Title III under the Older Americans Act, authorizing legislation to support a program that provides grants to states based on a population status of 70-year-old individuals and above. One program of support is the Caregiver Respite Care Program, which is mostly overseen at the local level by the area agencies on aging networks in the community. With the creation of NFCSP, members of Congress recognize the important role that caregivers play as a support system to the numerous aging adults that need assistance in their daily lives. Research studies examining the utilization of respite care services suggest that many aging adults who are eligible to receive these services fail to do so. The various reasons include unfamiliarity, limited funding, caregiver guilt, meaning letting someone else temporarily do the caring, mistrust in others for the aging adult, and lack of program qualities. Socioeconomic statuses do play a large factor in eligibility of the program's requirements. Unless financial requirements are met to receive the care services through community health centers and agencies, most families won't be approved to receive the services. Because Medicare coverage under hospice care was first introduced at a time in society when the population of older adults 65 and older was much lower, and chronic illness, disease, and disability was also much lower, it doesn't meet the needs of the expanding population today. How about expanding the current coverage for Medicare? Or how about adding coverage for in-home respite care, which could be provided under the care of an order of a primary care physician These physicians, through the referral of RNs within a home care agency, could monitor the respite care and code and bill properly according to the Medicare Part A policies. Recommendations and in conclusions are: increase the tax rate for working individuals to offset the cost of expanding or changing the current coverage in place. Change the coverage percentage and increase the existing days of coverage for Medicare Part A hospice care and respite care. Respite care programs have shown a reduction in caregiver stress, resulting in less elder abuse and neglect and fewer hospital admissions. This results in a lower cost for medical care under Medicare Medicaid coverage for hospitalization and emergency room visits. Finally, utilize the respite care services and create public awareness about the positive aspects of the service.